this is a $2.3 million grant from the National Institute for Occupational Safety and Health, or NIOSH. It's a 4-year study. It'll be conducted in 11 cancer centers, elite cancer centers across the country with over 300 nurses. And our principal questions are first to characterize the issues of personal protective equipment and potential exposure to chemotherapy that oncology nurses face on a daily basis. First, we want to learn more about that. What is actually going on in practice and what can we learn from? The second thing we're going to do is test an intervention. We believe that nurses understand these health risks, but they downplay them. In our prior work, we've shown that maybe half of nurses don't wear personal protective equipment as NIOSH recommends. And we have to take ownership of that, and we have to change that. So we're going to test 2 interventions. One is a web-based educational module on simply the facts and figures of the NIOSH alert. The second intervention takes that information and then brings it directly to nurses who tell us about the barriers that they face in practice every day on wearing this equipment. So we're going to tailor the messaging directly to nurses when they say, this is the problem I have with PPE or personal protective equipment. We have a vignette that talks about a nurse who successfully navigates that. The other unique aspect of the second intervention is we will give the data back to nurses about the spills that occur in the study and the exposures that we learn from, so that they have a better understanding of what is going on in practice and how they can better protect themselves. Our pilot work suggests that when nurses get the feedback, they're far more interested in behavior change, adopting the right practices, thinking about the equipment they're using. We've known about this problem for 4 decades, and we haven't solved it. And so I think it's time. This is the first study I know of that is an intervention study, controlled intervention study for this problem that we've been dealing with for 4 decades.